So hi, my name is Kelsey. I'm a physical therapy student at Campbell University, and today we're going to be talking about intercarpal instability. So for this assessment, it's kind of, you're just looking at joint play between all of the carpal bones. And so I kind of wrote down what you're trying to assess right here. So the scaphoid on the lunate, scaphoid on radius, lunate on triquetrum, and so forth. And so we're going to now zoom in on the hand so we can kind of see what we're talking about here. So for this test, according to Dutton, all you're going to do is grab the person's wrist, and you're going to use both hands, and you're going to pinch, the scaphoid and then the lunate, and then you're just going to shift them on each other, and then the lunate on the triquetrum and shift, triquetrum on hamate, hamate on capitate, capitate on trapezoid, and trapezoid on trapezium. And then you can go back and do the distal row on the proximal row. So then you can do the trapezoid on the scaphoid, capitate on the lunate, and then we already did hamate on triquetrum before. You can also do the scaphoid on the radius as well if you're looking for that instability. So you're just looking for one that moves too much or one that moves too little to just kind of assess how the stability is in the carpal bones of your patient. Okay, so when you're going to be performing this on an actual patient, you have them sitting on a stool next to you, and then just have their wrist either kind of just on the table, you can have it hanging off the table, it really depends on your preference. So where I like to start is finding the scaphoid tubercle, right in here, and then I know that I'm right on the scaphoid, and then right next to that is going to be the lunate. And so I'm just going to pinch the scaphoid between one set of fingers and the lunate between the other, and then just shift them on each other. And then you can go and put your other hand on the lunate and then find the pisiform on the underside of the hand, and then you know you're right there on the triquetrum. And then you can shift those on each other. And then above the triquetrum is the hamate, so you can shift those. And then you can follow the third metacarpal down to where you kind of fall off this ridge, and then you know you're on the capitate. And then you already know where the hamate is, so then you can just do the hamate on the capitate, and then the capitate on the trapezoid, and then the trapezoid on the trapezium. And then you can go back and do the distal row on the proximal row. So for example, you can find the capitate again, and then find the lunate and shift the lunate on the capitate. But also make sure that you go back and do hamate on pisiform and trapezoid and trapezium on the scaphoid. And then you can also do scaphoid on radius, just depending on what you're looking for. And you're looking for any of the bones to move too much or move too little to indicate that there's an instability somewhere in the wrist. So now I'm going to perform this technique as I would on a patient and try to speak to her in layman's terms. So Kim, I hear you're having some wrist pain, and so one thing I want to look at is I want to look at the movement in your wrist. And so you have 8 different bones that make up your wrist, and so what I'm going to do is just move each one of them on each other and just see if one moves a little too much or one moves a little bit too little, and then from there I can know what I need to do in terms of treatment. Okay. Okay. Do you have any questions about that? Mm-mm. All right, cool. So for the video purposes, I'm only going to do her affected wrist. I'm going to leave the good wrist, but you should do both. So let me know if you have any pain with any of these. So like I said, I'm just shifting the bones on each other. It might feel a little bit weird. Mm-hmm. Okay. No pain with any of those? Mm-mm. Okay. You do have one that kind of moves just a little bit more than I'd like it to, and the one right next to it just moves a little bit less. So in my treatment, I may try and get that one moving a little bit more and then try to make this one not move as much. Okay. Okay?